My role is an integrated clinical team manager, and I manage the two community hospitals in Llanidloes and Machynlleth and the community teams and the physiotherapists and occupational therapists. And part of my role is to make sure that patients are in the place where they should be. So if they're in a district general hospital and they need to be transferred home or they need to be transferred to one of our community hospitals, and there's any problems with that, if they're people with quite complex needs, then I might get involved with that. And that's one of the ways that I tend to work with our social work colleagues. The other aspect of my job, where I work very closely with Myra and social services, is that I manage the continuing healthcare team of nurses. And every 2 weeks we have a panel which takes place in the council offices at Newtown, and Myra is part of that. And again, it's an opportunity for us to discuss as a team people with very complex needs.
I'm Myra Pryce. I'm the team manager from social services, covering Newtown and Welshpool areas and every area in between, including Machynlleth and Llanidloes. For many years, we've had a very close working relationship with our health colleagues, which we're currently building on, as Lesley says, with things like continuing healthcare, also new projects such as the extra care housing in Newtown. My involvement mainly in healthcare cases is around complex discharges, complex cases in the community, where there's usually issues of concern, where people are perhaps living in very difficult circumstances, needing high levels of support. So we work very closely with the district nursing teams, OTs, physios. We also have quite close involvement with housing associations and housing as well.
Well, I think we're very lucky here in the North locality because we're building on a very strong base of integration, and we've got staff who are very keen to develop that further. And I think integration will look like a faster and more streamlined service for the very complex patients, and an ease of communication between health and social services and different professionals by shared electronic patient records.
I think already we've got teams within teams, because we've got very close working relationships here, for example, where the OTs, physios, social workers all meet as one team in the best interest of the service user patient, whichever term we want to use. I think we're already seeing some benefits for local people. Particularly there was a meeting in Machynlleth where people came along, they were very positive about what was happening, the staff working much closer together. They see it as a single point of contact into one team. If we can, organise that, I think it will be beneficial. If somebody can drop into the surgery and see whoever they want at that one place, I think that would be exceptionally useful. And I think it's about also getting the GPs a little bit more on board with what we're doing.
One of the challenges that we have in this part of North Powys is the rurality. The staff tend to be based more where there's a bigger population and then cover this very rural area as well. And I think in the future, one of the things that I'd like to see is more support for the virtual ward, but that might be using more technology, so having healthcare professionals videoing into virtual wards or audioing in. I think that's one of the things that we're seeing in the future. So building teams that in some areas might be more virtual teams, but nevertheless still effective, based around the GP practices.
So the use of things like technology, like I use Link quite a lot to join meetings now in Landard, Brecon. Far more better use of my time than actually driving to these places. It saves me a considerable amount of time.
I think as well having the electronic patient records, the WCCIS, will make a huge difference as well, because if a patient needs the involvement of another professional, it'll just be a matter of an electronic referral done instantly, whereas at the moment that can take much longer, and then that professional will have access to the notes of the professionals who'd seen the patient before, And I think having that shared patient record will make a huge difference.
I think it's basic things such as the district nurse wanting to know how many care hours are going into an individual, that they'll be able to look it up themselves without phoning into social services or trying to contact the social worker concerned. That will really aid the process and save considerable time for staff and ultimately make it better for the patient service user.
And I think that will really help us avoid duplication, because it'll be very easy for one healthcare professional to find out what days somebody else is visiting, so that they don't go at the same time and give people unnecessary visits. Or again, if they do need to join up and visit together, it'll make it much easier for them to do that as well.